My first job I got about 3 years out of high school at a home for disabled children, and I just fell in love with it, like literally right then. So I went back to college, and I've been a career learner and a lifelong nurse. I've never done any other job, literally. I fell in love with not only the kids, but feeling like when I went home, I really made a difference in their lives. I spend a great deal of time with my patients just trying to gain their confidence, because if your patients don't trust you, they're not going to do what you're asking them to do. And if they don't do what you propose for their treatment plan, then they're not going to get better. So you have to really work on establishing that rapport before you can just start going straight to the medicine. My philosophical approach to medicine is just holistic. It's treat the whole body and the whole family and listen. Parents are reading more, they're online more, they're flooded with information on social media, and they want to be their child's advocate in their care, and they want to be a collaborative partner in their care. We have so many options for care. We have ancillary providers right here in our office. Just the fact that we opened a salt room, that's a huge thing for us. There's no other pediatric office that has that. When you think about what we do here at the Cannizzaro Integrative Center, we don't just treat a cough or treat a sore throat. We look at the whole child, we listen, we take extensive histories, and then we look at the core reason or the underlying cause for the child getting sick in the first place. Because if we do our jobs right and we start from the beginning at their well checkups, and we've got them on the right diets and we've got them on the right supplements in terms of whether or not they need additional vitamins or minerals or anything, and we get all of those things done ahead of time, they're not going to come see us very often for illness. We just aren't going to see a lot of sick kids here if we're doing our jobs really well, because we focus more on health and wellness and keeping our patients out of the office. The number one question that I get asked from my parents and my patients has to do with vaccines. They want to know, are we pro-vaccines here in our clinic? And there is not a standard answer for that question, so I just talk to the patient about what the options are, what my recommendations would be based on their own child's personalized needs, and then we take it from there, because we have a lot of options for vaccines these days that we haven't had historically. This is an amazing staff we have here. They're just some of the most caring individuals I've ever met, and I love the families who come here. They're committed to the well-being and the welfare of their children, and they're willing to think out of the box with us.